Hello, everyone. I'm Sarah from the Intertribal Council of Michigan. I'm going to be helping facilitate today's webinar session on the national project, the Vaccine Equity Project, strategies to encourage vaccination and address hesitancy. This webinar is recorded and will be available on our website afterward. We'll have some time for questions, a good amount of time for questions towards the end, but feel free to type them in the chat box. And I just ask everyone stay muted during the presentation to minimize background noises. And our presenter today is Hannah Wickern, and I'll let you introduce yourself and get started. Thank you.
Awesome. Yeah, so thanks, Sarah. My name is Hannah Wickern. I work alongside Sarah at the Intertribal Council of Michigan. And we are here today to talk about the Tribal Vaccine Equity Project and some funding opportunities that come along with it. So let's see here. I can run my slides accordingly. So first of all, I want to say thank you for coming today, registering, and like I said, just learning a little bit more about what this project is all about. Our agenda is fairly brief. We're going to be talking about a short overview of what the project is and how it came about. We're going to talk about some of the opportunities and then leave plenty of time, like Sarah said, to go over any questions that you might have. So what is this? The Tribal Vaccine Equity Project is hosted by the Intertribal Council of Michigan, and it came about from a grant called the Vaccine Equity Project. We have, kind of refocused the name to include Tribal Vaccine Equity Project as we work with American Indian and Alaska Native communities. The grant came from the National Network of Public Health Institutes, NNPHI, and the full title of the grant is the National Infrastructure for Mitigating the Impact of COVID-19 within Racial and Ethnic Minority Communities. So we've dwindled that down to the Tribal Vaccine Equity Project. As you can see, it's quite the mouthful. The goals of this project really are to reduce COVID-19 vaccine hesitancy, increase access to those vaccines, and then also increase uptake, all of which we know have been challenging throughout the pandemic. So we're hoping to offer some strategies, training, technical assistance to support that. All right, so the Intertribal Council of Michigan, our approach is, it involves quite a few different aspects. One of those is providing healthcare provider training and resources to address patients' concerns, questions, hesitancy surrounding vaccines, and supporting, while also supporting collaboration and partnerships with trusted community organizations and businesses to host vaccine events and, like I said, make them accessible. Yeah, there's a lot of different ways that we're approaching it. Those are two of them. The third one on the bottom there is promoting vaccine education materials. So we know those have the ability to change attitudes and behaviors. So that is also a piece of this project. We're planning to utilize the National Native Network's communication channels to broadcast these opportunities. For those of you who are not familiar, the National Native Network is a program of the Intertribal Council of Michigan. And it's a really great platform that encompasses tribes, tribal organizations, and tribal serving programs to deliver resources and technical assistance. So it's something that we are utilizing and where you'll see most of our materials for the project. So maybe what you're here for today the funding opportunities that come along with this project. So we do have funding opportunities, or awards as we've called them, for 10 tribes, tribal health centers, or other tribal serving community partners in 4 different categories. So you're able to apply for one of those categories, a combination of those 4, or all 4 if that's something that you're interested in, with a total award amount of up to $26,500. As you can see here, the project length is fairly short, running only 2 months, but there is a lot of flexibility in how these are run, and especially the reporting. We aren't asking for a lot. We know that you know how to serve your communities best, so we're hoping to provide these awards to let you do that. So I hope you know. I hope the short time frame doesn't sound too bad. I do want to highlight that all available funding that you see here is available nationwide. I know our name says the state of Michigan in it, but please know that that does not limit this work to one state. We are offering these to all tribal organizations, businesses, health centers across the United States, and we're really excited to be working in that capacity. So those who are eligible for these funding opportunities, like I mentioned, are any tribes, tribal health centers, tribal healthcare providers for the trainings that we're offering, and then tribal serving community organizations or businesses. This is, this could be tribal or non-tribal businesses, and we just ask that those who are applying serve a community or population consisting of at least 50% Native American community members. And if you do have questions about that, I'm happy to talk with you afterwards or offline about your specific questions. So really offering to quite a few of those that are interested. So I'm going to kind of break down the 4 different opportunities for funding. The first one being for healthcare providers. We know they're a very trusted source of information when it comes to any health information, and more specifically vaccine information. They play a vital role in building confidence in vaccines through transparent conversations and being able to answer questions and concerns of their patients, and also to dispel any misinformation, because we know there's a lot of that out there. If one healthcare provider joins in on these trainings, or excuse me, let me rephrase that. Your tribal health center where the healthcare providers are employed are eligible to be awarded up to $7,500. We have a list of resources and then 3 trainings that can be completed and that are eligible for an award. Once you fill out the training, we just ask that you complete a short survey, and we will mail that check out to you. So I think this slide will clarify a little bit. To receive the full $7,500 award, all 3 trainings must be completed by at least 1 staff member from your tribal health clinic. We highly encourage to have, your entire health staff complete the trainings. However, we know people are busy. So if one of your health care providers is able to delve into 3 of these, or if you have 3 different healthcare providers that each want to delve into one, or better yet, more that want to delve in, that's how you are awarded the lump sums that you see here. So 3 trainings, $7,500, 2 trainings, $5,000, 1 training, $2,500. And then the next slide here, you can see the different trainings that we do have available. all of these are to better communicate with your patient population about vaccines. We are also hosting a webinar in April, which we will make sure to send out the details of that, highlighting the How I Recommend CDC resource, which it's a set of videos and it helps you navigate conversations with patients. But for the award opportunities, these are the 3 trainings that we're looking to have you complete. So once you're done with those, you just fill out a short survey and hopefully share what you learned with your other health staff. So the second opportunity is for those who want to host a vaccine event. Maybe you're already planning on hosting one. Maybe you're thinking about having a vaccine kind of booth in any, an event that you're hosting, and you want to kind of compile the 2. This is a great award for doing that. And mind you, it can be primary or booster doses. So you're able to submit up to $15,000 to support your event. Please know that when you apply for this, you'll be receiving half of that award up front to support the cost of that event, and then half once we kind of get those numbers back from you and have you do a short evaluation interview, so we can learn like what worked well for planning your event and maybe what was challenging. So you'll be receiving half up front and half after the event. The main goal is to meet people where they're at by partnering with tribal serving businesses or organizations, whether that be, like a hotel, a casino, a cultural center, wherever you can meet your community best. That's a great way to partner and be able to get vaccines out there. Like I said, we've had one interest in offering booster doses during a community event that's already planned. So that's something that could be awarded. We are going to be hosting a few webinars on best practices on planning and executing events. So we're going to be able to share those proven methods with you, and then hopefully learn from others who are in attendance on what worked well for them, kind of like a learning lessons learned kind of session there. So we ask that you attend one of those to set you up for success. When you apply for this funding opportunity, it's just a quick survey. We have it linked here. Unfortunately, I don't have it pulled up or else I would show you, but it's just a quick survey. You describe briefly your proposed event. Maybe you're hosting a mobile vaccine. Just give us a quick little blurb on that. How you plan to record the number of vaccines you administer and report it to Intertribal Council of Michigan. Again, happy to work with you on that if that's something that you have questions about. And then a proposed budget. This is not meant to be a line by line kind of budget. It's asking, what amount do you need? It is meant to support costs like supplies, extra staffing support, communication materials to promote the event. But please know, we're not asking for what you're doing with the money. We just know that you're utilizing it best to support vaccination efforts. So I see something in the chat here. Melissa asked, does this include urban Indian health centers? Yes, it does. And then Sarah has in the chat also a link to our webpage where there's a little bit more information and where we'll post this after the event. So, all right, moving on to the third opportunity. This is really a good chance to host interactive educational events. So when I say interactive, I mean something like a roundtable or a Facebook Live or a Zoom session where you're listening to the community and understanding their concerns and then providing information. So this could be a great time to have a provider facilitate a discussion, maybe a trusted, excuse me, a trusted community member. But really the main goal of this is to answer those questions so that people have the information that they need to make an informed decision about their vaccination status. So let me dive in just a touch more here. So the application process for this opportunity is very similar to the last. We just ask for a brief description of what you're planning to do, maybe the target number of attendees that you'll reach, and then how you plan to record learning outcomes. So whether that be, in a Zoom session like this, where you put on some polls, or maybe you have a survey before and after. So just ways that you can track that. And then also, the number of people that attend, we'd be looking for that as well, with a proposed budget. This opportunity only has an award amount of $2,000. So if you are thinking you're going to use that amount, that's what you would apply for. And again, you get the $1,000 up front, and then you would get the $1,000 after the event is completed. So it's really meant as an accountability mechanism, and then you have that award to work towards other vaccine efforts. And also, again, no budget breakdown necessary. So this could be I think this would be a really fun event to host. Let's see here. And then we have the fourth and final. This health education promotion award is an award of up to $2,000, broken down the same way as the other two, the previous two. We ask that you display a minimum of 10 pre-selected health education materials. We have a list of those. We're adding the last few and then putting them on the website, so you won't see them just yet, but we will have those by the end of the week this week. We know that health education materials have the ability to influence decisions and change behaviors. What is the word that I'm looking for here? Change attitudes, there we go. And so if we can host those either virtually or print materials, put them up in places where your community is, where your community goes, that they can be seen. That's a great way to get the word out there. The reporting mechanism here is just letting us know. Oh, I'm on the wrong slide here. When you apply, excuse me, similar to the other opportunities, we just ask that you briefly describe how you're going to go about displaying the materials. Is it going to be virtual? Are you going to post them as, are you going to print them out as posters? Your target reach for the promotion, and then how you plan to record it. So whether that be, an estimated potential reach or social media analytics. Again, we're happy to work with you on ideas for those if you have them. The breakdown, the budget breakdown is the same, half upfront and half afterward. And let's see here, we have just a short list. This is not extensive, but these are some materials that you could share. And we ask that you share them for oh gosh, I already forgot. We ask that you share them, for 2 weeks. So 10 materials for 2 weeks. And that's really you can post them for longer. We'd be happy to see that, but at least 2 weeks would be wonderful. Are these So a question in the chat, are these opportunities available to all tribal healthcare system? Yes. Yes, they are. You can have your healthcare providers participate in the first opportunity. You can have the healthcare systems host the events, the virtual events, and even post the education materials. So thanks for asking that, Laura. All right. So I just want to highlight again, I know I've said this on each of those opportunities, but for the vaccine events, the virtual events, and the health education materials, half of the award will be provided up front and half will be provided upon completion when the outcomes are reported. For the healthcare provider trainings, you, just complete those and then fill out the short survey afterwards, and you receive that award via check. So those are the funding opportunities. And I do want to highlight one last thing here. As part of this project, the Intertribal Council is presenting a tailored media campaign, or launching a tailored media campaign. The title is Care for Us by Us, Tribes United to Fight COVID-19. The campaign focuses on increasing vaccine confidence in and uptake of COVID-19 vaccines with American Indian and Alaska Native communities. We've been able to do some messaging and graphics testing across the US to see what resonates well. We know that it's not applicable to every community, but we were able to get feedback from across the United States from those who were unvaccinated. So we're hoping to be launching print and virtual materials that we will be distributing with this program as well. And then, those will focus on addressing concerns about the COVID vaccines, really with transparency and fact-based messaging. So be on the lookout. You can follow us on our social media channels. We've got Facebook, Twitter, Instagram, and LinkedIn. Those are all linked here. And then if you want to, I don't have the link here, but Sarah included our website in the chat there, keepitsacred.itcmi.org /COVID-19 vaccine equity. You can join our mailing list, and that's where you'll hear more about the media campaign, more about all of the opportunities that come with this project. So a very short little condensed version of the opportunities. And I'd like to just take the rest of the time to go over any questions that you might have. I know there were some in the chat, but feel free to unmute yourself and ask any questions that you have. Or if there's anything any ideas that you have, or anything at all. Happy to talk.
Can you hear me?
Yes, I can hear someone.
Yeah, this is Laura Shepard, and I'm a community.
Oh, you cut out.
So I was.
Oh, you're cutting in and out. I think I can hear you now.
Can you hear me better now?
Yes.
Okay. So my name is Laura Shepard, and I'm a community health nurse for the Iowa Tribe of Oklahoma. We're located in Oklahoma. And are we still able to participate in this?
Yes, absolutely.
Okay. And so can we piggyback this off of a lot of this stuff we're already doing? So the events that we have scheduled, we just need to basically send you the information that we have on.
Yeah.
And we can, so that's acceptable? It's just one
of
those sounds too good to be true opportunities. So I'm like,
yeah. Well, and it's meant to be an award. You've done so much hard work throughout this whole pandemic, and you should be awarded for that. But yeah, if you have events that are already planned, those are those are eligible, definitely. We just ask that you, participate in those interviews afterwards, so we can learn a little bit about how your events went, and obviously how many vaccines you got out there.
Thank you very much.
Yeah, you're welcome. Any other questions right now?
Hi, can you hear me okay?
Yes.
Hi, so we're thinking about having some community events outside of COVID. So for example, we're working on Hep A vaccinations for a specific subset of our community. Is that okay?
Yeah.
Like if it's not a COVID vaccine specifically right now?
So that's a good question. I know with one of the folks who are interested, they're hosting like a men's health event, but they are offering COVID vaccines during that event. Are you going to be offering just Hep A vaccine, or are you going to be offering COVID as well?
We haven't started planning for these quite yet, so we can, if that helps, to get approved.
Yeah, I mean, I think the overall goal is to promote vaccines. So yes, I would say if you can offer COVID vaccines during that event, that would definitely be an eligible opportunity. Does that make sense?
Yeah, because we were actually planning to do Hep A vaccines mostly, but yeah, we definitely can incorporate COVID vaccines as well.
Okay, yeah, definitely then. Love to get back. And I'm not sure, I think it highlighted it in the slides, but I just want to make sure that I'm reiterating it right now. The short timeline of this, so the events would need to take place sometime between now and May 20th. Just so we can get that information, the information back from you and report it on our end. So just be thinking about that as you're planning your events as well.
Gotcha. Okay, thank you.
Yeah. Was there somebody else wanting to ask a question? Not sure if I heard you pop in.
Yes, I do have a question.
Sure.
So you want to emphasize COVID-19 vaccinations, but you do not have to adhere simply to that type of vaccination. It's vaccinations in general, but you want to emphasize COVID-19.
Yeah. The emphasis is definitely on COVID, but we know that other vaccines are down right now. And yeah, those need to be promoted as well.
Okay. All right. Thank you.
You're welcome. All right. Not hearing any more questions. And it sounds like it might be a good time to give you a half hour back of your day. I'll go to the last slide here. If you do have any questions, my email is right here, hannah.wickern@itcmi.org. Happy to talk through any ideas that you have. If you need help going through the application process or you have questions, just reach out and let me know. Other than that, we will have all of this information available on the website, which again is in the chat. And you can join the National Native Network listserv. That is a good chance to get, communications from us as well. So with that, I will stop sharing my screen. And Sarah, I don't know if you have any closing remarks.
Yeah, I think you hit it. I was just gonna say, make sure you're on our listserv, so you can be informed about, we'll have some of those upcoming webinars, which is a requirement if you are hosting a vaccine event. And also on our social media, so we can communicate. And thank you, everyone.